And tonight, we talk population census. And my guests include Mr. Stephen Bariahirwa, Field Operations Officer for Census, Helen Namirembe Mviri, Director, Population and Social Statistics, and Dr. Fred Muhomuza. I want to welcome all of you for having given us the opportunity to be with you. Let me begin with you, Dr. Fred Muhomuza. Most welcome to the show.
Thank you very much. Blessed to be here outside the UBOS house.
Helen Mvili, thank you for honoring our invitation. Welcome to the show.
Thank you very much. I'm glad to be here. It matters to be counted.
And the man with a good name, Mr. Bariahirwa. Stephen, thank you for coming.
Thank you very much, our host, and happy to be here to talk about being counted with the census night being tonight.
Let me begin with you, Stephen, because this is something you understand best. This is your area. This is something right within your docket. I'm going to start with a very general question. What is the census and why the census?
Thank you. A census is the counting of people, but we normally combine it with households, rather with houses. That's why we call it population and housing census. That is normally done because we want to know how many we are in the country, such that we can plan for the population better based on information that we have collected from the census.
So when they talk about the census night, because that's a word that is being thrown all over, what is the significance? What is it all about? Why is somebody talking about census night and it's such a big deal?
Census night is a point where you take like a snapshot of whoever is in the country at that time. Because the census doesn't take place in one day, we have to have a reference point where everybody was in the country at that time, such that when we come to your households, homes, and you are asking questions, we have that reference point. And that reference point differs from person to person. For example, we are saying census night is today at midnight, but there are people who we shall take to have been at home even if they are away. For example, I'm here. If it reaches 10 past midnight and I get home around 1, I will not be taken that I didn't sleep at home because I'm at work. So those kinds of people will be considered that they were at work and now they slept in their homes.
Helen, I can imagine tonight you have maybe tens of thousands of foot soldiers who are enumerators all over Uganda. But how prepared are they? What facilities do they have? What kind of training have they gone through? And what kind of challenges are they likely to face, and how do they go about them?
Thank you very much, moderator. We've had a series of training sessions. It has been a cascade training which has been at 4 levels. We started with training ourselves. Much as we are experts, we need to be together, same wavelength, have the same issues and concepts defined. Then that was the first level. Second level, we invited all the district census staff. We gathered in one place at Millennium. We trained them for 9 days. Then the third level, these people went back to their districts and cities and trained the sub-county supervisors, who in turn have recently, that was yesterday, concluded the training of enumerators. The enumerators have been given all the data collection tools, they were given all the training materials. We are doing a digital census, the first of its kind in the country. So they have electronic devices and they have other materials, although we have experienced some delays. They're supposed to have a bag, they're supposed to have they're supposed to have reflector jackets with a big word at the back, Census, Uganda Census 2024. So these enumerators, the training ended yesterday, and today they were supposed to canvass the enumeration areas getting to know their boundaries and getting to know their local guides to be prepared for tomorrow, or starting this evening.
When you talk about the digital census, in comparison with the others that you don't have, and if they are having tools, it's the month of May, it's raining all over, and maybe, I don't know whether they are using their battery charged tools, or whether they need to use electricity, and whether they used to be on the network of telephone networks. You know, have you put that into consideration, that they could find themselves, you know, in challenges of technology?
Yes, the challenges are there, and we have received these complaints, and we have experienced these challenges during training.
So you mean you have done a dry run? Also?
Yes, because we have been in every sub-county in this country where we've been training, because that has been our focal point for training the enumerators. And if you look at this country, the infrastructure is not evenly distributed. Some areas are underserved. You find that the network coverage is poor. We have areas of Karamoja, we have areas in the north where they have considerable challenges. We have had two service providers, that is Airtel and MTN, but MTN being the largest service provider. They do give us SIM cards, and we have installed them in the tablets. And these SIM cards are only going to be used for remitting data from the field to our servers.
Okay.
Yes.
Let me come to you, Dr. Fred Muhumuza. This scientific data collection exercise, really, of what value is it? And even if we get that data, do we have, you know, an experience and a record of putting to use scientific data for service delivery in this country?
Yes, we do. And first of all, really, I want to congratulate the country and the Bureau of Statistics that this is the first time we are actually having the census 10 years after the other one. It's supposed to be every 10 years. So the first one was 69, the next was supposed to be in 79. Those who are older know there was a war, so we had it in 1980. We were supposed to have another one there for 1990, we didn't. It spilled over to 91. We should have had one 2001, it didn't, it spilled over 2002. The next was 2014. So this is the first time that we are making the 10-year mark. And 10 years really give you a good span, as they have said, of not only looking forward to project and plan better, but also looking back. What has happened? Those dynamics are very, very important. And the census is not a survey. A survey you will sample, but the census is trying to pick everybody.
The numerical strength of the country.
The numerical strength of that country, so you are able to know. And there are many of the government agencies that are using information that is geographically located. We are saying you want a primary school. How many children should be there? And my primary school is looking at age 6 to about 13. Now the census will give us an idea on that. You're looking at health facilities, doctor-patient ratio.
Just pause there. When you talk about the primary school, because at the end of the day, census data collection is supposed to help you in service delivery.
Yes.
Do you know that about 1.8 million children enroll in primary one?
Yes.
But less than half of that will sit for PLOE. This government has no idea where over 1 million Ugandan children go in the space of 7 years.
Exactly. Now yes.
So the census is not used.
No, this is going now to help us to say what has been happening to those children. Because now you are going to the real household where those children stay. And you are going to discover this one is 15 years and he's saying I didn't finish primary. So the census information begin to tell us this one primary is finished at 13. How come you are 15 and you didn't finish primary? Then I begin to know where did the other 1 million go. What happened to them? Because the census has so many questions. And I want to encourage people to really be patient and answer all these many questions. Because each researcher will be looking out for something in this particular detail of the big survey.
Let me bring it back to Mr. Variahirwa, because we were scared by some newspaper headlines that you're going to subject us to 180 questions when the enumerators come to our home.
Even our tea gets cold.
Why are you questioning us left, right, and center up to 180?
Thank you, moderator. The questions are not a few. I cannot say there are many. The questions are not few, but all of them are very important. you know, we deal with the many stakeholders, and the census is conducted once every 10 years. So whenever there is a chance of asking some questions, then we bring them to census. But even then, the number that is being presented, there are some questions which are valid for a certain group of household members and are not valid for others. So,
for example,
if you come to questions of pregnancy, children never born, what, all men will not be answering those questions. When you come to...
And what is the hidden meaning?
The what?
The hidden intangible knowledge from that.
Yeah, of course you run a route from that. And of course there are other questions which are like when somebody says, or disability questions, if they ask, do you have difficulty hearing? And you say no, there are a number of questions that you skip. So the questions may look very many, but do
you have a difficulty? Do you have a problem of hearing? And he says no, or he says yes.
Then there are some questions, you know, it may ask you when did it start, what, but some of those will be skipped when you have a no. So that's how the questions look many, but indeed some are valid for a certain class and some are not.
You are telling us that when the enumerators come to somebody's home, they will not be asking questions at a go, but they are asking people one at a time?
No, let me explain to the population properly. When you go to the household, we have the household questionnaire. The household questionnaire is the one which will introduce us to the household, and it will first collect information on all household members, beginning with the head of the household. So there will be individual questions asked, and if the household member is, rather the household head is available, he will be the one to answer the questions on the household and the members of the household. Then after that, you go to other questions that concern not individuals, but it concerns the household, like sources of fuel for cooking, sources where do we dispose garbage, those kinds of questions. There will be a one-off. Then the questions related to women will also be asked. So it is one person who answers for the household for those, say age, sex of household members, and then when it comes to other questions, especially those that are specific, then that's when we can get that other class of that specific group to answer them. But it will be either the household head or any other knowledgeable household member who will be at home by the time the enumerator comes to the household.
Is it true that you will be asking young girls age of 13 and above on matters of reproductive health, but also you go deep into asking about planning methods they are using, family planning methods they are using?
Yes, our beginning age.
A 13-year-old, Helen?
Yes, our beginning age is 10. It's not that...
Wait a minute. Beginning age of 10, what do you mean?
Some children in almost all countries, their sexual behavior, they begin early. These days, children are exposed.
You are telling that what you have found, you know, you are population scientists, right? Yeah. That what you have found, that children in Uganda as young as 10 are sexually active.
It's the first time we are collecting this information. It's an SDG indicator. We want to know how many children have indicated that they have had children. Even though the survival, even though these children are, whether they are dead or whether they are still alive, but the issue is, have you had a child? The age group of 10 to 14, it cuts across all countries, and Uganda has already taken on these SDG goals as part of this development framework to get responses, to get indicators. You know, we are moving towards the end.
So these are minors. So these are minors, right?
The census is the major data collection, because you find that the numbers get smaller, so you can only do this in a census.
Helen, you're talking to children who have not reached majority age, and you are asking them very complicated sexual reproductive kind of questions. Are you mindful that you are dealing with people who maybe are not prepared to have that kind of conversation?
There will be a filter. Of course, not all of them will be able to respond to this. And it's not that we are the ones imposing. we have had, when we developed these tools, we discussed at length with all stakeholders why the benefit of having this information, looking at also other possibilities of not having it. So it's not that we are the ones imposing, but the stakeholders have come to us over time. For a very long time they have been requesting for this information. And that's why we have included it in the census.
So Dr. Fred Muhumuza, when information like this is being sought from young people as young as 10, 12 and 13, then it also means that there's a possibility that the government will be planning to give them, to encourage them to use the family planning method like pills and stuff like that. Because if you find there's a problem, children are having children, then how do you mitigate it?
You have two things really. One, getting to know is what this information will give us. What we do with it is another discussion. And the discussion could be not to give them contraceptives or whatever it is, but to say what is the cause of this now that it is there. Because this information will tell us. We thought it is after 18. But now we are going to discover there are people who have had children below 18. What are the causes of this? But Dr. Muhumuza, how do we address them? The data, scientific data collection process will probably tell us, and I think the projections are telling us that children in Uganda are producing fellow children. Yes. And for that matter, and which is not good because they have not yet reached age. Certainly. So the possibility of discussing giving them contraceptives is very likely. Yeah, of course, those are the options that could be on the table. Do we give them? Do we deal with what has caused it to happen? And in the meantime, before it happens, you know, the religious leaders, I remember in the 90s, who were opposed to use of condoms. But then we said people are dying. Well, your behavior changes. Let's first stop the death. So you may want to say, we want the children to stay in school. It will also help us, by the way, because some of us have been working in studies on HIV/AIDS. How do you get them back in school? Because quite often the moment they give birth, social stigma and all sorts of things, people just dump them. Their parents say we have ashamed us, all sorts of things. Now we will begin to come up with policies to say how do we get these children back in school. But first of all, we need to know, are they there? What numbers are we dealing with? And by the way, to also begin to help when you corroborate the information. Is it associated to certain religion? Is it to certain regions? Then you begin to zoom in into those particular areas where you have found. Mr. Baryahirwa, Uganda is one of the fastest growing, has the fastest growing population. And the biggest percentage of our population are young people. But I know you have some projections. I know you have some estimations. What is this exercise likely to confirm?
Well, yes, you are right. Uganda is predominantly have a younger population. From the surveys, we normally see it when we do our projections of the data that we collect. You find over 50% are below 50 years, rather 15 years. Now, this census is also going to tell us now, since we did the last census, has the structure remained the same, or is it changing now? If it has remained the same, like you had a population of from a certain age contributing about 50% of the population, is it still the same? If it is the same, what can we do to make sure that the population, like what you are talking about the family planning, about all those things, to make sure that we have a productive age not below a certain point. Okay. Yeah.
Is this census also be looking into the life expectancy and the fertility rate and things like that?
Yes, we are collecting information on the total number of children ever born for the woman. So we'll be able to get fertility history of a woman.
Why for the woman?
No, that's where we have the evidence, because she's the one who carries in the womb.
Dr.
It's
Didi,
like
Dr. Fred,
you must see.
The evidence is only on the woman that she has
Yes,
children, but
yes.
as far as the rest of us,
Sometimes we don't know we have children, and yet we do. No,
Yes.
Sometimes we are told we have children which we don't
sometimes
have.
we are told that may not be true.
Yes, but
This is very serious. You're talking.
yes, where the event occurs, it happens with the woman. So that's why we capture information on fertility. We collect data on births that have occurred in the last 12 months. We are able to measure the current fertility. And through the children, never born children surviving, we are able to come up with measures of infant mortality using the indirect methods. Though I don't want to go into the technicalities, but it's true we'll get life expectancy at birth and for all ages at current. Because we are coming up with a life table, we will be able to generate this even at lower levels.
All right,
Like
Helen Vidi, Dr.
yeah.
Freddy Muhumuza, and Mr. Stephen Variahirwa. Gentlemen and lady, we're going to take a break. When we come back, we will be looking into the issue of the demographic dividend, on whether Uganda can actually have a demographic dividend or maybe a demographic catastrophe. We'll be right back. On the spot, my name is Patrick Amara. My guests tonight are Mr. Stephen Variahirwa, Helen Vidi, and Dr. Fred Muhumuza, and we're discussing the census that begins. The census night is tonight, and how is it going to be handled? I understand, Stephen, that you intend to mount roadblocks across Uganda, and for the traveling community, that tomorrow is going to be hell on earth.
Thank you, moderator. We don't intend to mount roadblocks. What we intend to do is to make sure we count people, especially truck drivers, people in buses, traveling from whatever place to another destination, who by midnight will not have reached their destinations. We intend to make sure they are covered. And how shall we cover them? We shall cover them where midnight finds them. If they cross over, and after covering them, we shall give them a sticker on the cars that they have, the trucks.
So wait
and
a
what.
minute, Stephen.
Yes.
So are you saying if people are now in the bus in downtown,
Yes.
you'll have your enumerators at the bus terminals?
Yes, we shall.
And for those already on the road going, how do you get to them without stopping the bus?
No, it is not kind of a roadblock, but we shall get some points. For example, if a bus leaves here and around maybe 1 it reaches Masaka and it does no sticker, the person in Masaka will stop the bus. Will stop the bus.
You're using other words to describe the roadblock, though.
Yes, we are not mounting roadblocks the way they are, but we have like checks along the roads to see whether you have a sticker, whether you counted or not.
Yeah, but the issue is you just have to stop the bus.
Yes,
to look for the sticker.
Yes, you have, indeed you have to.
Okay,
yeah.
That's a roadblock. So Helen, what happens when you meet uncooperative Ugandans who do not want to be counted? I'm sure also some, for their cultural, religious beliefs, some people don't even believe in counting children. How prepared are you to handle this?
Well, we have told our enumerators to be cooperative, to use all the tactics they can. If it goes beyond their control and they can't manage, immediately they inform their supervisors to come in. At times we give these households time, and the guide or the supervisor may come and talk to them, and then you move on to another one. There is a code for not completing that record, which shows that you have not yet completed the enumeration for that household. And you can always make another visit and you do complete.
So participating is compulsory?
It should be.
What is it? No.
Yes.
So in other words, if somebody does not cooperate and they refuse to be enumerated, will they have committed a crime?
It is true. they will not have cooperated. But we don't want, it's really, you are supposed to give us the information, and it should be correct, as His Excellency said, and also other eminent leaders have explained. But if you don't, we don't want to enforce this law, because we are, a statistics body is always with the people. We are with the community. You don't want to fight with the community. You want to work with them in harmony. You want to cooperate so that you get the best.
Okay.
And for many data collection processes, you will never find a smooth flow. It's like these challenges are there. We have trained our enumerators. We have dealt with them over time.
Those are occupational hazards.
Yes, it's not that they are new to us. We know how to handle some of them. We have given them most of the examples and experiences we've had.
You know, this census comes right after we have seen political parties have been moving around Uganda, also trying to register their members. NRM the other day, they said they had 18 million subscribers, and so I think NUP and others are going around. There's a possibility that they could mistake them for the same, and you find the people who are apprehensive about all this activity. Don't you think, Dr. Fred, there could be a mix-up, especially when Ugandans are tired being asked so many questions, and with the parties coming, and now already, remember, the electoral roadmap is on.
Certainly, but the good thing is the census has had a different campaign and messaging compared to the other censuses that have happened. So I want to believe people out there would be able at least to make a distinction that this is a different thing from what they have had. And right as you've said, it is parties that have been coming, looking for their members. So, and the hierarchy, as she has mentioned, as Helen has mentioned, there's an enumerator. If an enumerator meets a challenge, they escalate to a supervisor. And a supervisor has more knowledge and skill and competence and the people management skills to try and go over some of those hurdles. And if that fails, then you go even a much higher level. So I'm really hoping that those distinctions, people will appreciate them. And the messages that have been sent by His Excellency and their communities, but also now we have LOCs are involved, the local councils, the other government officials are involved on a non-partisan basis. So I am hoping we won't get that much, but you can't rule out a 0.1% that somebody may fail to make a difference and say, how come?
Let me change gears on this one, Dr. Muhumuza. You are an economist, you're a researcher, and I'm sure you rely on data. Yep. Considering the projections that have shown us the population growth, do you believe Uganda will be able to harness the demographic dividend that many have been talking about? Because it appears from my end that the young population that we have has not been prepared, skilled, and educated well enough for the 10, 15 years from now for them to add real value as is expected of them.
The dividend is really very many things. As people say, as gross profits have been made, you get paid. Now, many people will believe a large population is good. Some of us say, no, it's the quality of the population. Now, in Uganda, as we've said, we already know we have a large population and a young one, which is a burden to me and you. You're trying to run and invest, fees comes in, sickness comes in, food comes in. At the end of the day, you have no money left. So you don't even prepare them well. Now, in most cases, these are estimations. Now we have an advantage to get the real facts. How skilled are these children? Where did they go? You have already mentioned about 1 million disappear between primary 1 and P7. Now, those don't project for you a dividend. But also a dividend means, fine, they are graduates, but what are they doing? This census will at least also begin to give us some pointers that even the ones who have educated haven't found an opportunity to work in a way that they should be earning from their brains. Because I don't think a graduate on a border, he's earning some money. But really we need to train him for that as a country. And the dividend is not supposed to come out of that. So this is going to raise for us a lot of questions to say, are we doing the right thing? And I've been waiting for this census because really I use a survey. And I'm like, a survey, these are 47 million Ugandans. how much information are we picking? So a census allows us to recalibrate even the in-between surveys that we've been doing.
We have been hearing from projections and even earlier census data collection that we have one of the fastest, maybe the third fastest growing population in the world. And I've been thinking, we're in Africa and here in East Africa, what makes the Ugandan women or Ugandan population so fertile? What's the magic with the womb of the Ugandan woman?
she's more of a demographer than me. But of course, you can see.
But really, what sets us apart? Because we're in the same region and we're about to catch up with Tanzania, with Kenya. They are huge geographical landmass and we are at a supersonic speed. What is it? Is it that the Ugandan men are so much at work, or the Ugandan woman has an effective womb?
Yeah, it depends on the structure of the country also. You know, when the press is called and the people go to bed early, you know what normally happens. Because a lot of information has been given to the population, especially on ways of how to control the population. But you see, every time we do a demographic and health survey, which gives us a number of those figures before we do the census, you find out there is a very slight change in terms of total fertility and the other figures. So there is a lot of research that needs to be done from those numbers, whether it is the way the structure the country is connected in terms of the temperatures, in terms of what people do. You know, if people have not gone to school, there is a tendency of having many more children. From what we have been analyzing, when we look at those who studied to higher education, tertiary, compared to those who never had the school, more education. So those are the figures, the facts that people need to understand and know. Okay. Yeah, even if other countries are also in the same category, but ours has failed to go down drastically in terms of total fertility rate.
Could it also be that because of our sufficient food production mechanism, because we are food secure, and so people are not as reluctant to have children like in other countries because they can actually be able to feed them?
Okay, if I could come in, there are quite a number of factors building on what he has said. The common ones, like those confounders, the issues we learned in school, there's those which are immediate and those which are socioeconomic. The breastfeeding patterns, the postpartum amenorrhea, the period. You see, when a woman goes to deliver, the issue of contraception, what are the levels of using a modern method of family planning? When I go to hospital to deliver, who at that gate, who is my gatekeeper? Somebody should be counseling me. I shouldn't leave hospital without a method. So we also talk about postpartum family planning. To what extent are we using it? The other issues are, of course, we know the level of education, where we live also, whether in urban, rural areas, the services we provide, and whether they are also youth-friendly from the other side. But also it brings in an aspect of empowerment. When we talk about interspousal communication, there are so many factors. Can you discuss family planning? You have a desire. Yours may be, because even in the surveys we see, when we ask women, if you could go back to the time you wouldn't have children, how many would you like? Their desires are less than those for men.
But sometimes sometimes also when they produce maybe males, they keep on trying to look for a female, and then almost even risking dying on the job.
There are also others. There are so many the cultural factors, the perception of children in our society. It's like, today you wait, in 2 days they're asking you, how is the mugore? Things like that. Is she getting fevers? It's like immediately the value of children in society. Are women empowered to say no? Let me wait. Let me finish this degree. Let me go for this course, even if it is tailoring, even if it is this. Is she empowered enough? to say that these are the children I should have, and then you also agree. Because now that is where the problem comes in. And also maybe talking about the past. In the past we were hit by HIV, but now I think it has gotten to a stage, because you would also look at them as providers in the future. Insurance. Look at our systems of insurance. In the developed world, the insurance systems are there for old age. Me here in Africa, some parents look at their children as value. You get me? Let me have children. They will look after me.
Which in most cases is never the case, by the way.
The social, yeah, we call it the social.
Because today, Helen, we have 30-year-olds
Yes.
in the homes who are being taken care of.
Yes.
Because circumstances maybe have pushed them to that
Things
direction.
are changing.
And you cannot say that the children will be your social investment.
Yes.
It's no longer the case.
But remember me in the rural area, in the rural setting. So what do I do? So I'm not saying that is the only, there are quite a number of factors, things are coming in, but also our levels of using contraception and other issues to do with services. We also don't look at the mother only, but also when we get to these health facilities, am I empowered to make decisions as a youth? You get me? Are there youth-friendly corners in these hospitals? You get there, you need these services.
You know, Helen, what is interesting?
They affect.
What is interesting, Helen?
Yes, they
now that you
affect
talked about
some of my
corners.
decisions.
You know, the youth are the majority
Yes.
in Uganda.
Yes.
But when it comes to hospital, you want to serve them in a corner. Why are you serving majority of your people in a corner? Does it make sense?
Okay. No, we are not saying that it's really in the corner.
The youth corner. This is
the providers of these services. Do they have knowledge how to manage the youth?
Dr. Fred Muhumuza.
So do they have all these skills? Do they know their needs are totally different from those of the adults?
Dr. Fred Muhumuza, today there are some Ugandans who are bitter. There are some Ugandans who, there's a lot of hate and bitterness and all that. The other day you saw the president addressing the traders. I don't think that the situation was not as good. And some of them I had saying, you know what, they're trying to gathering this data to come to us again. People are likely to misinterpret it. Do you think they have done a good job, UBOS and the government of Uganda, in preparing the mindset of the Ugandan person in understanding census? Because some people can think this is about taxes.
Yeah, you know, the beautiful thing, as we've said, the census is every 10 years. So this is not the first time. I want to believe majority of the people who are going to be answering these questions at the household level were there in 2014. They are older, so they will remember that experience. And hopefully, saying hopefully, because things do change in people's minds, they will be able to remember that this had nothing to do with politics. But I know 2026 is around the corner, and census information is used in determining constituencies. So you cannot separate a lot of other things, and now they are putting even a bit more questions. Some are religious, some are, they are so intrusive a little bit.
By the way, Dr. Muhumuza, please don't scare us. Are you saying there's a possibility that they could even increase the constituencies?
Of course there was a roadmap, but as we know, this is going to inform the enumeration areas. Some people may use this to say, oh, my constituency is so big, so why don't you split it?
That's the reason why they have built a Nambole size of parliament in the middle of town.
Why don't you split it? So you cannot stop some of those things coming through. But at least that is at the political level. The people giving us the responses should be able to understand what the census is about. And as you have indicated, there are questions on immunization. Part of this population bulge is basically because we have now immunized and fewer people have died. So they have reached into the productive age, so there is that momentum. If you have half of the population, that's about 22 million people being below the age of 15. Even if each of them just said, let's have 3 children, in the next 20 years, you possibly are going to have some 25 million from just this group alone, and they will have brought the ratio down to only 3 children. But you'll be having 25 to 30 million children coming in. Now, this information, we will need it, and it's my prayer that the people supporting the processes, and please, let's not end tonight and tomorrow. This is census night. The census is going on for another 10 days. These messages need to go, because there are people who are going to be reached on 12th, on 14th, on 15th. It's my prayer that the Bureau has put in place measures that quickly pick what was the experience of the first day. How do we therefore improve the second day? So by the time we get to the other people, and that's indicated, a household that refused to be enumerated, maybe when you come back on 17th, you have learned how to deal with those hardcore families. So let's engage continuously, and I hope the media will give them all the time that they need to continue engaging and educating and bringing in the information on what has come out as we churn out.
So how do you intend, Mr. Bariahirwa, to go into military installations, prisons, and correctional facilities and police, including the safe houses?
Thank you, moderator. We have worked with the security agencies in the planning of this census, and in all past censuses we normally work with them to see how best we can enumerate those populations. First, we have the army, the police, and the prisons. The army, we started training with them after the training of trainers here. We had a training in Munyonyo for them to conduct now rower trainings with some of our people and them to be able to enumerate. The same thing with the police. We had big barracks like here in Kampala, where police trained their own. In Nakawa, that UNAFRI. In other areas in the district, police also trained with our enumerators, but they will be helping to enumerate the big barracks, and then the people who will have slept in the cells, like on the tomorrow morning, they'll be able to cover them. The same with the prisons. So we have worked together to make sure all the sister agencies of the armed forces also take the counting of the populations in their barracks, of their households, their wives, their children, to be counted, such that it also becomes the part of the population of the country.
Have you heard about safe houses?
I used to hear about them, but we were told they are not there now. If they are there, I don't know how we can identify them. But we didn't request like UPDF to look for safe houses because we were told they no longer exist in Uganda. I don't know how true it is, but we asked that if there are any safe houses, how shall we enumerate them? We were given that information.
Is there any sensitive question that you may have, and maybe household members, all of them are not supposed to hear them, and probably between man and wife? Helen.
Thank you, moderator. The sensitive part could be for women, where we are asking for information regarding their reproductive outcomes and behavior. We are asking them to give us the total number of children ever born and those who are surviving. Of course, it's for fertility measurement and the other things. By the way, even we measure information on teenage motherhood. Our girls start early. So the sensitive bit, we have trained them in the sense that where if the mother or the female is present, because it applies to all, if a female is present, talk to her in person. If she's not there, then you get the particulars from the head of household, because she knows better what she has gone through. Some women may conceal information about their reproductive life, especially those who had children outside wedlock. She might not have declared to her spouse that she has a child. Some auntie, some jaja is keeping this child. So, but we don't know. And for us, we don't want to antagonize these households. We want to live in harmony. We don't want to split them. So we are very, very cautious about this. So we usually talk to the mothers to give us the information, but where they can't, we'll get it's the head of household to give us the information. Otherwise, because we ask about information whether they are currently pregnant, whether they have had children, and where are these children? Are they living with them? Are they living elsewhere? Or are they dead? So don't get worried that your children, the mother will count for you. So the other questions, they are not really sensitive. They are the general questions which you can ask when everyone is there. We ask about your biodata. When were you born? How old are you? Your education, your highest level of education, whether you are working, whether the child has been immunized, whether the child has a birth certificate, whether you...
And that child is child number what? The
yes. Yes, okay. Whether you are a refugee or not, or an asylum seeker. So we ask so many questions, but there isn't a sensitive question.
Helen, Stephen, and Dr. Muhumuza, we're going to take a break, and on the spot, we'll be right back. Welcome back. You're watching On the Spot. My name is Patrick Amara. My guests tonight are Dr. Fred Muhumuza, who's an economist, Helen Namirembe-Mviri, Director Population and Social Statistics, and Mr. Stephen Bariahirwa, Field Operations Officer for Census. So let's talk about money. Last time I understand government was putting in maybe 75% in, and maybe other sources are giving you money. And this time I'm told they have increased about 98% locally funded. But what kind of budget are you working with, and is it sufficient?
Thank you, moderator. We are really working on a big budget because, you know, this census being a digital census, we had to make big procurements, especially of the tablets that are going to be used for this exercise.
I thought technology is supposed to cut the cost.
Maybe
not to increase it, because
at the end,
if technology is going to increase the cost, then why do you have to get it?
At the end, in terms of time and the other resources, maybe
this thing happens after every 10 years.
Yes.
So you're going to keep the tablet after 10 years, and then you come use the same?
Yeah.
Is that what you're telling us, Stephen?
No, we have got, well, the tablets are going to be used, of course, for other things. So it is a big saving, because maybe we may not need to buy any more tablets for like NIRA or whatever and the other data collection exercises. But basically the government has put in over 327 billion shillings to do this exercise, and the donors have put in a little to also supplement. But indeed, as you said, most of this activity is being funded by the government, 98%.
Okay.
Yeah.
And I remember the last 2014, I think the population census found that we had 250,000 refugees or thereabout. But now I think in Africa we're the #1 refugee hosting nation. And of course you don't even expect that this is going to happen. These must be real challenges to plan for. Helen, isn't that a big task for government? Because if you just wake up one day and you have 1 million extra.
No, we know the numbers. One, we have mainstreamed in our strategic plan for statistics in the past. We've supported Office of the Prime Minister to collect data on refugees. So when it comes to the numbers, we have a feel. Prior to the census enumeration exercise, we started with a general listing. We did the listing, and the numbers are to guide the deployment of how many people should work in a given area. So unless it is just this night, even those at the reception centers will count them. Even those at homes, we know in Kampala they are already there, they are established.
But urban refugees?
Yes, urban refugees. They are working, and so we'll also enumerate them. So we already have a feel it's not going to be like, unless it happens tonight.
Okay. Dr. Fred Muhumuza, I understand that there's a possibility of some countries that I don't want to mention to inflate the population, because a bigger population will attract a bigger budget support, but also maybe people want to invest, they think you have a bigger market, because the market also determines the population. Is there a possibility that the government can do something like that?
You want to leave government aside and say, is there a possibility that you, boss, can do something like that? And I'm not seeing it on this panel here, that they are going to do that. Now, that speaks to, is you, boss, independent? Is it professional? And I think from our history, that has come through. Many times people have questioned you, boss, data, and I've asked them, where is your alternative? Can you present your evidence? And I think the Bureau of Statistics really in Africa has been ranked, the Ugandan Bureau of Statistics has been ranked as one of the best by global partners, but also the donors who are putting some money, they have been giving that support. And they also have a feel of what to expect. She's talking about refugee numbers. You cannot inflate them, because in any case, they are funded by the donor communities as well. So they too are involved in that statistic. So a lot of Uganda's information is actually out there for people to tell. But also we do projections. Projections are telling us what do you expect to find in Kabale. If that figure is plus a very big number of what comes out, you begin to even check it out. So I want to trust that the means that have been put in place is going to give us the right figure. You might actually, as we've said, get a smaller number. Some people may object, some people may hide the information, but I don't think anybody is going to inflate at their household level to a magnitude that would deviate the national figures.
321 billion shillings. That's quite colossal sums of money, Stephen.
Yes. You know, some of these things sometimes you have to invest if you are going to really get something which is going to help you in the next long run, in 10 years. You know, we have to be basing on these figures. You know, it gives us a frame for surveys, for whatever. Maybe to add on what he has said, how have we planned it to make sure the figures are not inflated? In every district, we have a representative of the Census Commission in that district, who is sent from the headquarters, who is working with the district staff, the district census officer and the assistants and the IT officers. And since we are using tablets, of course there is a limit to the number of households a person can do per day. So you cannot see 45 households being entered in one day. Even at night, you know, you will know that somebody is doing what? Is doing something funny. And we have also a situation room here where we are going to be monitoring from tomorrow as the data starts coming in. So we shall keep monitoring at every other time, so there is no room for anybody to manipulate the system such that they can get more numbers than the ones there.
So Helen, when do we expect to get results of the census population data collection exercise?
Thank you. We'll have results at various levels, or we'll release piecemeal. And the first results within 3 months. It can be 2 weeks, it can be 1 month, it can be 1.5 months. We'll have the results. The total counts simply by sex and area. That in Mityana district we have so many males, so many females. In this sub-county, just a quick count, we have to give results to the public.
So within 3 months we get the final or the preliminary? What?
We'll first have the preliminary results, because these are just quick summaries which we do before we go into checking the data, the validity, some of the responses, some of the records, and trying to not to phase out, but to know that this record is really meets the standards of minimum to be minimally processed. But what we've done, the things we used to do in the office that time to check are now being harnessed at the time you are collecting the data. So that's why we give ourselves that period. But within, let me say, within 1.5 months, 2 months, we'll have released the data.
Okay, and Stephen, I just listened to a radio show this evening, and one of the enumerators called in and surprisingly was asking somebody at the radio station who is not from Uyubos, whether you will be providing them lunch or food as they do their work. And these are your people you have deployed, and they're already saying, why are we going to work on empty stomachs?
Yeah, thank
you. Are
you
you providing them lunch, the people?
Thank you, moderator. We shall have a package. We have a package which I'm sure everybody knows, whoever is an enumerator, which is of 50,000 per day for 10 days, which will come to a total of 500,000 for entire data collection exercise. So we thought if we start giving them bits, lunch, transport, you know, it may be difficult to manage. So that's when we thought we needed to give them that kind of package, such that they all know how to spend on it. But it's 50,000 per day for the 10 days of data collection.
You know, the information coming in, Dr. Muhumuza, is that some of the food soldiers who will be moving around are not really well prepared in terms of mind. Some of them were asking such questions about food and things like that. And
Ugandans will always ask, even when you have provided, they are all over twist. There is always a question for one more. Of course, 50,000 for some of these young people, and you really have to use the younger population because the exercise is foot soldiers. So you don't expect a 45-year-old to be an enumerator. You can be a supervisor. And young people, this is an opportunity. Some haven't worked for a whole year or 2 years or 3 years. This is an opportunity. So imagine they would be pushing further to say they have not given us food, but when they have their 50 in the pocket. So those things you expect them out there. But I'm sure they have been trained. And there will be food around there that they can buy and really eat. As I said, logistically, you don't want to follow them with food. But money in their own pocket allows them to buy something along the way as they move through. Some terrains, you can't even follow them up for food. But you'll find something to buy. So I'm sure that has been taken care of.
So you're not actually counting Ugandans, but you're acting the people who are in Uganda, all of them on that tomorrow and moving forward, right? Everybody, the de facto population. Is that what you're going to be counting?
Yeah, we are going to count everybody who will have been in Uganda as of midnight tonight. Whether Ugandan and non-Ugandan will be counted. Okay. Yeah, that's why we are telling people to keep that information of anybody who will have slept in their homes as of tonight. Because if they wake up and go tomorrow and we go there on the next Wednesday of next week, we want to be able to get that information of that person who was here tonight but has since gone back because he was in the country as per our reference period.
All right. We are coming to the end of our show tonight. Let me begin with you, Dr. Fred Muhumuza, to give us your concluding remark.
I think I really want to encourage Ugandans to give information willingly and accurately, because we really need this information. The census is not something we do every other day. As you said, 320 billion. You don't want to be spending that every 6 years or 4 years. So we're going to have the next one in 2034. So, but this information should help us to get to that level. So I really want to encourage everybody to give as much of this information. We use it for many other things, really, for research, for planning, for understanding where we are and where we need to be going. So Ugandans, please kindly participate and give the information that is needed. You are not even going to be singled out and say this was Zakayo who stays in this village. No, that information is shelved, and then it's just households and the numbers.
All right, thank you, Dr. Muhumuza. Helen, your parting shot.
Thank you very much, our moderator, our dear listeners, our viewers out there. We are seeking your cooperation. Work with our local councils, work with our enumerators, the public. If we miss you in this census, you are going to be left behind for 10 years. We don't want to leave anyone behind. Please be counted. It matters to be counted.
Thank you very much, Stephen. What's going to be your parting shot?
Thank you very much, moderator. I will not deviate from what the other panelists are talking about, because why we are here is to tell the whole Ugandan public to really participate in this census exercise. As we have told you and explained in the different trainings for those who have been there, this information will be used in aggregate form We shall not single it out and say so and so is like this. So we want you to cooperate with our enumerators. They have been well trained, and we have told them how to behave, and they will be easily identifiable. We are giving them those reflectors and a tag to identify them. We apologize in some of the places they may be reaching late, but I'm sure tonight everybody should be able to get it. But please cooperate with our people, and you know that it matters to be counted.
Thank you very much, Mr. Stephen Variahirwa, Field Operations Officer for Census. Thank you, Helen Naminembe Mviri, Director of Population and Social Statistics. And thank you, Dr. Fred Muhumuza. But most of all, thank you, the viewer, for the time you have given us, for the privilege of your company. Kindly participate tomorrow, cooperate, because the data collection exercise is good for you, is good for everyone else, and is good for Uganda. If you cooperate, it would be a good thing to do so. Good night and God bless Uganda.